Thanks, Tara. Okay, you guys know here at Emotional Mojo, we always encourage you to take control of your own life. Well, guess what? That applies to your health as well. And when it comes to your heart, are you doing enough to protect that ticker of yours? Well, here today with more info is heart transplant cardiologist, Dr. Nirav Raval. I want to thank you for being here with us.
Thank you for having me.
You're going to clear some things up for everybody because even I was confused about heart failure and what it means and how to look out for it. So I think it's really important to have you here to help us out today.
Great.
So thank you. First of all, tell us a little bit about what you do. What's a typical day for you?
I'm a transplant cardiologist. I'm a type of cardiologist that sees patients with perhaps the weakest of the hearts that are around. And so I may see patients in the office. I may be in the heart catheterization lab seeing patients there and helping them with various procedures. I may be involved with a team of people that might be helping somebody with a heart transplant or a ventricular assist device or a heart pump that we use to help people with weak hearts as well.
Wow, okay. And since today we're talking about heart failure, I think this is one of the most important things here. A lot of us have a misconception, and I originally did as well, about heart failure. To me, I was thinking, oh, that means your heart just suddenly stops and that's it. But that's not exactly the case. What exactly is heart failure?
Heart failure exists when the heart has become weakened from some reason to a point where the patient actually doesn't get enough blood flow around the body. That's actually what heart failure is.
Okay, and we were talking a little earlier about this. It's not necessarily that certain people are predisposed to this. This could happen to anyone, different ages, different health, right?
Yes, it can be from, for example, a heart attack might weaken a heart through muscle of the heart actually dying during one of those incidences.
Sure.
It can happen where a viral attack occurs of the heart and the heart is weakened because of that. It can happen for a variety of reasons, but the end result is that the heart muscle itself is weakened, and now the heart has a tough time to pump blood around the body as a result.
So being that it's something that's chronic then,
Yeah.
it's definitely important to continuously monitor patients who have heart failure, correct?
That's right. As you said, the heart doesn't stop just all of a sudden. It actually kind of fails over time, and it's a chronic disease process that needs monitoring.
So a lot of people think keeping up with their heart health too means all I have to do is keep an eye on my weight and my blood pressure. Those seem to be the typical things to take care of. But is that enough?
For heart failure, no. I think that you really have to be monitored by medical professionals, doctors, et cetera. And I think that's important because things can change over time. And what once worked for you, perhaps even 3 months ago, may not now.
Sure.
And just needs it warrants looking at.
So you mentioned monitoring, and this is really exciting because for some people this may be an option. There's a new monitoring system that's available for managing heart failure.
Right.
Can you share some of that info with us?
Yeah, it's actually an implantable sensor that looks at the pressures in the lungs. As I mentioned earlier, you have a situation where there's quite a bit of fluid retention, and sometimes what that does is it allows for the pressures to increase in the lungs. So the sensor that you have in your hand there is actually something that will actually measure that change and allow us to have an idea about somebody's health before it may result in something like a hospitalization.
Wow, and I want you guys to see this because it's actually really tiny, which is why I have this dime in my hand so you can see the comparison here. How does this work?
This is an amazingly simple piece of machinery on the one hand because it has no battery. It is energized through a signal, a radio signal, and that signal is bounced back to a device that can measure the actual pressure in the body.
This is exciting. I mean, what's the reaction been like from patients and doctors?
Yeah, I was originally involved with the clinical trials in the United States, both the feasibility and the pivotal trial that was used to prove the efficiency of this type of sensor and clinical effect. And it's been amazing because physicians now have something that they could only get in the heart catheterization lab, but available actually at home, which is tremendous for us. And then the patients on the flip side were so excited about this because patients that were admitted to the hospital with heart failure with fluid and those kinds of things, now had a vastly different experience because it stopped a lot of those readmissions to the hospital.
Now, we know it's not for everybody, but if you talk to your doctor and they decide this is a route to go, there are some questions you should always keep in mind with your doctor for an appointment. Let's say you're talking about this kind of procedures. Are there certain questions we should be asking?
Yeah, I think that if a patient has had a few hospitalizations for heart failure, they may be a candidate for this. This is not for everyone.
Sure.
But I think, you know, some experience with putting the device in or doing these types of invasive procedures would be helpful to ask your doctor so you feel comfortable with it too.
Yeah, I mean, we want to know things. What are the risks, you know, for this procedure for me? How long will it take? How long will I be in the hospital? Things like recovery time. Questions like that are important for you and any family members or caregivers to take note of.
Very true.
Yeah. Another tip I liked that you had mentioned earlier, when you go to your appointment, bring something to write with. I know a lot of us don't write anymore, but why is that so important?
I think it organizes your thoughts, and I think that people that come into my office, as an example, that have a list of questions, we can really go through a lot of information in a very short period of time. And and you can get more out of your actual visit with a physician, myself or otherwise. So I think it's a great way to organize your thoughts. I usually call them court reporters. Usually it might be the significant other of the person that actually is coming, you know, the patient's sitting up on my table, and I call them the court reporters in the corner and recording things. And that's good because when you get home, sometimes you tend to forget, and it reinforces it if you look back at what your notes were.
Or you'll come up with another question while you're reading. You know, are there any side effects to keep in mind, or, you know, things that people should be aware of?
In terms of the sensor, I think that the sensor is a pretty easy procedure to do. It's actually something that you can do very quickly. The risks are very minimal.
Okay.
As far as just general things to keep in mind when you're at the hospital with your office is, you know, ask about your medicines. Is everything still necessary? Do I need to make any changes?
And these are the reasons people should talk to their doctors about it, because it may not be for them.
Right.
But I love this. There's a really great resource for anybody at home who wants to get some more information here. Can you tell us a little bit about that?
Yeah, heartfailureanswers.com.
Okay.
It's a great way to get very good information on the internet. I mean, I think there's a lot of internet sites out that are you wonder what you're getting.
Sure.
But this is kind of a very good adjudicated site where you can get really good information that you know is going to be accurate.
Well, thank you so much. I really appreciate it, Doctor. And guys at home, if you want to learn more, you can go to heartfailureanswers.com, which also lists important safety information. And remember, talk to your doctor to see if this is right for you. Thanks again.